Tumor necrosis factor alpha, also known as cachexin or cachectin, or abbreviated as TNF alpha, is one of the chief cytokines involved in systemic inflammation. This cytokine has a few clinical effects that make it particularly high yield for exams. But before you get too heated, I'll give you my mnemonic so you can remember everything you need to know about TNF alpha. Speaking of getting heated, it's pretty warm in the seafood kitchen. As you can tell, our head chef is preparing his world-famous snow crab. The secret to getting the perfect moist crab is actually wrapping it in tinfoil. Nothing locks in the flavor like tinfoil. You know, now that I say it aloud, tinfoil reminds me of TNF, since TNF stands for tinfoil. Don't you know? Just kidding. TNF stands for tumor necrosis factor alpha, but you should just use this tinfoil to anchor you to this scene about TNF alpha. Next, check out that cage containing our seafood destined for the tinfoil. Crab pots are just a type of cage, right? We'll get back to the crab later, but for now, let's focus on the cage. This cage is our recurring symbol for macrophages, because like cages, macrophages capture and contain objects. It's the macrophage cage, or the macro cage, right? Let this cage here remind you that TNF alpha comes from macrophages. Macrophages secrete TNF alpha in the context of infection or injury. As part of the immune system, TNF alpha therefore plays a major role in protecting us from infection. All right, back to the story. Where's all this tinfoil going to go? Into the oven, of course. See that open flame oven in the back? Our chefs prefer open flame even for roasting seafood. These flames should remind you of inflammation caused by TNF alpha. Flames for inflammation. Get it? TNF alpha is critically important for the inflammatory response, so much so that it is sometimes called the master regulator of inflammation. By inflammation, we mean the clinical constellation of heat, erythema, swelling, pain, and loss of function. TNF alpha achieves these effects in part by acting on blood vessels to increase blood flow and vascular permeability. In general, the inflammation is immunoprotective because it makes our body a less hospitable place for foreign organisms to live. Should be pretty easy to remember that tinfoil and flames go together, right? Next, notice how it is burning hot in here. All restaurant kitchens are hot, but this one is especially so with the open flame oven there. See how our chef is sweating as he wrangles with the tinfoil. This hot kitchen and sweating are actually perfect for remembering that fever is caused by TNF alpha signaling, since fever is just an increase in body temperature, right? TNF alpha works indirectly on hypothalamic nuclei to increase the baseline body temperature, resulting in fever. This increase in temperature also makes the body less friendly to foreign bugs. This symbol should be super easy to remember, especially in the context of all this fire. Afterwards, let's check out our main course, the crab over there. You know how these king crabs have these long, skinny legs? They always look super thin to me. Let the skinny legs of this crab remind you of the paraneoplastic cachexia caused by TNF alpha signaling. Let me break this down. Paraneoplastic refers to syndromes that accompany cancer, which is represented by our cancer crab here, since the symbol for cancer is crab, right? And cachexia refers to the weight loss and wasting seen in cancer. Put this together, this skinny-looking crab symbolizes cancer-associated cachexia. Tumors are notorious for releasing large amounts of TNF alpha, which you reason by examining the name, tumor necrosis factor. TNF alpha, as we know, causes an inflammatory response, which over time causes severe lipolysis, anorexia, and muscle wasting. If you've ever seen cancer patients, you might recognize how thin they look. You may also remember from the intro that TNF alpha is actually also called cachexin, due to this cachexia-inducing effect. Before we close, let's briefly mention some of the drugs that target TNF alpha, like infliximab, adalimumab, and etanercept. We'll cover these drugs in dedicated scenes, but let's just touch on the high-level facts. Since TNF alpha is so important in inflammation, these TNF alpha suppressing drugs are used to treat autoinflammatory disorders like rheumatoid arthritis. However, inhibiting TNF alpha signaling also makes the patient more prone to infection, such as seen in TB infections. In fact, TB reactivation is a feared side effect of patients taking TNF alpha inhibitors, so much so that we screen for TB in patients before prescribing these drugs. Well, that just about does it for this scene. Let's get out of the kitchen before this chef really loses his cool. Tumor necrosis factor alpha, or TNF alpha for short, is a cytokine secreted by macrophages. TNF alpha signaling causes acute inflammation and fever, both of which help protect the body from infection. Importantly, TNF alpha signaling is also involved in the pathogenesis of paraneoplastic cachexia. Lastly, TNF alpha signaling is targeted by anti-inflammatory biologic drugs like adalimumab and etanercept, which have the side effect of making us more prone to infections like TB. And with that, I think it's time for dinner. I hope they have something other than crab on the menu.